Okay, I want to turn it back over to Tiffany to talk about anxiety disorder.
All right. Great. Thanks, Peter. So I'm going to be talking about anxiety disorders, and within the category of anxiety disorders, there are many different types of disorders. So I'm going to go through all of them, but take a couple of them to really point out what might be some of the signs and symptoms. So when you talk about anxiety, when you talk about stress, the thing to realize with all of these is that everybody experiences stress. Everybody experiences anxiety. And so as you're reading this up here, I don't want you to think, oh my gosh, I've experienced that. I might have this disorder. It's very common to experience many of these symptoms. I mean, college is stressful, right? You've got school, you've got family, you've got friends, you've got work, you're independent for the first time, you've got all of these stressors going on in your life. So it's natural to feel stressed. And in fact, stress and anxiety are very natural reactions to these kinds of stressors. They're part of what's hardwired into our system as part of the fight or flight response. And so when you're under stress, your body responds in a certain way that's going to cause you to feel more anxious. And that's actually helpful for you because it helps to motivate you to get things done. But most of us, when we're feeling stressed or feeling anxious, can bounce back. And when it's a sign that it might be more of a problem is when some of your symptoms of anxiety are more persistent, consistent, when they are more intense or more severe, when they seem to be out of your control. So if you're worrying and you feel like it's out of your control and you can't stop it, or when you're engaging in compulsive behaviors and you feel like you have no control over that. And also if it's significantly interfering with your life. So if it's causing you problems in your relationships, if it's causing you problems in your school or in your work, that also is a sign that maybe this is something a little more serious. So, so I talked about stress versus anxiety. These are some of the typical behavioral and physical symptoms and psychological symptoms that just in general, if you're experiencing anxiety, you might experience. So often, anxiety is about fear. So fear, panic, nervousness. A lot of people that are anxious can't stop thinking about things. They not just worry, but they worry about the same thing again and again and again and again. They can have intrusive memories, recurring nightmares. That specifically happens with people that experience post-traumatic stress disorder or PTSD. And then often people that are very anxious will tend to withdraw or avoid. So for example, in social anxiety, they tend to avoid situations that might bring on that anxiety. Or people that get physical panic attacks, they'll avoid going into places where they think that might trigger a panic attack. Some of the physical symptoms of anxiety, again, I'm sure all of you have experienced at some point. People that experience an anxiety disorder tend to experience these things more often, especially in situations that tend to trigger the anxiety. So things like, having butterflies in your stomach, your heart is racing, you're trembling, shaking, you might feel hot or cold flushes through your body. You might feel that muscle tension or dizziness. And you also might feel things like you might feel like you're very out of control, or you might feel like you're dying. These are some of the physical and emotional symptoms that people that get anxiety will say. And like I was saying before, in order for it to be considered a disorder, either it has to be something that the student feels that's causing them significant distress, or it needs to be something that's significantly interfering in their life, either with their job, their school, or their relationships. And then just to point out, it says 15%, rates are up, 15% of the CAPS clients that we see experience anxiety disorder. So just very briefly, anxiety, like I said, there are many different disorders within the realm of anxiety, and they can be caused by different things. So for example, there could be anxiety in social situations you'll see there, and so you've got agoraphobia and social anxiety disorder, and I'm going to go into some of these in more detail in a minute here. Some of the anxiety disorders that have to do more with physical symptoms are panic attack symptoms, or what's called panic disorder. Anxiety due to a medical condition, or else anxiety due to a substance that you're taking that's bringing on anxiety symptoms. Individual anxiety, so obsessive compulsive disorder, or having phobias, specific phobias about certain things, fear of heights, claustrophobia, fear of tight spaces. There is a phobia for almost anything. There's even a phobia for fear of clowns, for example. So, anxiety around a trauma that's been experienced, a crisis or a trauma, and that is acute stress disorder, or PTSD, which is known as post-traumatic stress disorder. And then just in general, generalized anxiety disorder, or what's called anxiety disorder, not otherwise specified. It's intense enough to be a disorder, but it doesn't fit into any of those categories.